Our coalition is the Shots for Tots Coalition of Louisiana, and our mission is to make sure that all children in Louisiana are vaccinated by the age of 2. Today we're participating in the Shots for Tots convention, in which we are educating our providers and providing information about the importance of immunizations and how to increase those immunization rates throughout the state.
Where does Louisiana rank right now?
Louisiana is actually ranked number 26 in the nation in vaccinations. We have about a 69% vaccination rate for our kids by 2. So we're making improvement, but we have a long way to go.
As a medical doctor, tell us a little bit about the children that you see and what are some of the barriers to vaccination.
Well, I'm a general pediatrician, and the primary barrier to immunization is actually access to care. The Vaccines for Children's program that Louisiana participates in allows most children to be vaccinated at no extra cost and improve their vaccination rates here, and thereby protecting them from illnesses such as pertussis and meningitis and measles and mumps.
What is the status of those particular diseases, not only in Louisiana, but across the country and across the world?
Across the world, there have been outbreaks of measles and other illnesses. For the most part, in the United States, all of the vaccine-preventable illnesses have been eradicated. However, we've been seeing some increased pockets of infections with pertussis in those people who choose not to be immunized, as well as measles in patients who have been exposed from parents and families visiting other countries.
Some diseases are resurging, like pertussis or whooping cough. Some people are opting out of vaccines and putting everybody else at risk. With measles all around the world, it can be imported here and cause large outbreaks. And some areas we're just failing in. With our HPV vaccine coverage for teens, we've really stagnated, and that means every year 1,400 more women will die of cervical cancer instead of having that cancer prevented if we could raise our immunization rates. So I'm talking about where we are, where we need to be, and how we can get there.
I'm talking about parents who are hesitant to vaccinate their children. And one of the messages there is that it's a very diverse group. They have lots of different reasons, and one of the strong messages, I think, is that providers taking care of these families need to recognize that part of their job is to diagnose their reluctance, to figure out what it is about vaccines that they're concerned about so that they can directly address that.
What kind of feedback have you gotten from parents on the issue of vaccination?
Well, most parents recognize that vaccines are important to both the public health and to their children, so there's not an issue for those parents. It's only maybe 10 to 20% that are somewhat reluctant and have read things on the internet that they're worried about, and only a small percentage of those are actually strongly opposed to vaccination.
And what's your advice?
Well, my advice to those parents is to be careful where they're getting their information, to make sure it's based on reliable sources and that the best source for them is their own pediatrician.
There's a lot of misinformation available on the internet and other places, social media, and a lot of parents have misconceptions about the safety of vaccines. We try to address those. We produce a lot of material to try to demonstrate to parents that a lot of this is urban myth and rumor, and in fact it's not based in science. So we try to, a lot of it is just misunderstanding and rumor and misinformation. So we try to address that whenever we can. Vaccines are extraordinarily safe, have no significant side effects by and large for the most part, and we try to help parents understand that so they can do the right thing and have their children protected from vaccine-preventable diseases.
The message today is about the importance of preventing HPV disease. HPV disease is a very serious disease. It can lead to some devastating consequences, including cervical cancer, anal cancer, and oropharyngeal cancer. We do have a way to prevent this with vaccination, and unfortunately, we do not have high vaccination rates as we would like in the U.S.
And tell us, what are the current rates now and what would be the goal?
The goal is to get as close to 90% coverage rate or higher as possible, and we are far from that right now.
What are some of the barriers to the teenagers being immunized?
Well, we feel that there still needs to be a lot of education, not only for the general public, but also for providers who vaccinate our young children. So education is key, and avoiding any missed opportunities, such as if a child comes into your office, making sure that you recommend that vaccine as you do other vaccines.
How serious a disease is this?
This is a serious disease. Data are now showing that over 90% of cervical and anal cancers are caused by HPV disease, so this is very serious.
What would you like people to keep in mind about the importance of immunization of all diseases?
That the most effective and the best way to prevent these diseases is through vaccination.
As a nurse, what do you see on a daily basis in terms of the need for immunization?
Well, in today's world, we see pertussis, or commonly called whooping cough, that we see the outbreaks, and can be very deadly for the young infants especially. So a very important vaccine, preventable disease, a vaccine for preventable diseases that we certainly are proactive with, encourage, and urge our patients to take advantage of.
Vaccination is complicated business, and people who do it people who provide vaccines for the public need to stay on top of what's new, because it changes very rapidly. There are new vaccines, new recommendations for old vaccines. So it's important that everyone who provides vaccines stay up to date on what's new and not miss any opportunities to vaccinate the people in their practice.
As a doctor as well as a mom, I encourage all of my patients' families to become immunized. Vaccinations have proven to be the most important health benefit in the 20th century.
As a public health expert and a physician, I can't tell you how important immunization is. Keeping our families healthy and safe is number one, and vaccines are the best way to do that.
What kind of response have you seen around the country in the last several years regarding immunization?
You know, despite what you hear in the media, nearly everybody knows that vaccinating is the right thing to do. Less than 1% of toddlers have received no vaccines at all. So though we do have problems with people opting out of vaccines in particular areas, most people know that getting their kids vaccinated on time, every time is the right thing to do.
You can go to the cdc.gov website and look up vaccinations. There's a special parent portion. You can also go to the Louisiana Shots for Tots website, and there's information about vaccines and frequently asked questions that parents may have regarding the vaccines.